Hello everyone, this is James and welcome to Lectures. Our lecture for today is about acute mountain sickness. What is AMS? AMS is a form of altitude illness that occurs from difficulty adjusting to lower oxygen pressures, and the cause, of course, is the decrease in atmospheric partial pressure oxygen that induces hypoxia. It happens at elevation of 2,500 meters or 8,000 feet. At sea level, the FiO2 or the fraction of inspired oxygen or oxygen availability is 21%. So that percentage allows us to breathe normally. Okay? But at 8,000 feet, that 21% will be reduced to 15.4%. And that's when we start gasping for air. And if you're wondering what is the oxygen availability at 29,000 feet or at the summit of Mount Everest, it's only 6.9%. So most of the hikers at summit Mount Everest, they usually bring a supplemental oxygen or portable oxygen, but some were able to summit without oxygen, a few hundreds, because they have superpowers. Just kidding, because they trained, they trained. Um, but that elevation might be lower for high risk individuals. For example, if you have heart failure, you might experience altitude mountain sickness at 5,000 feet or 6,000 feet. Or if you have sickle cell disease, obstructive sleep apnea, or any other forms of pulmonary insufficiency. What are the symptoms for AMS? Headache. Headache is the hallmark of acute mountain sickness. And because the brain is deprived of oxygen, that causes cerebral vasodilation, and that causes headache. Other symptoms are dizziness, loss of appetite, nausea, and vomiting. And sometimes it stops there, and sometimes it progresses into a more severe form of altitude illness, a high altitude pulmonary edema and a high altitude cerebral edema. What happens when you are in a high altitude? You will be hyperventilating, and that is the hypoxic ventilatory response. So if you have a hypoxic ventilatory response, it can damage or disrupt the blood gas barrier in your capillaries and causing injury. And when that happens, there will be an increased capillary permeability. So all those proteins and big molecules that supposed not to escape from the capillaries are now escaping into the interstitium. And as a result, the oncotic pressure within the capillaries are decreased, and those proteins in the interstitium are drawing the fluid from the intravascular into the tissues or the lung parenchyma, and that causes the buildup of fluid in the lung tissues and parenchyma we call pulmonary edema. What are the symptoms of pulmonary edema, the high altitude pulmonary edema? Chest tightness or pain, cough, dyspnea at rest, and then decreased exercise tolerance. High altitude cerebral edema. And the same thing happened with Hasi and Happy. There is a disruption of the blood-brain barrier causing the extravasation of protein into the tissues, and that protein will draw fluid from the intravascular into the interstitium, causing brain swelling. And the symptoms are the same as AMS, but it progresses into a more severe form. So you will have uh, um, decreased level of consciousness, problems with balance, and then slurred speech. How to prevent acute mountain sickness and how to prevent happy and hassy. acclimatization. So you need to acclimatize to allow the physiological response of your body to the low levels of oxygen. You will also avoid strenuous exercise or alcohol for 48 hours. And if you're drinking caffeine, you should not stop drinking. Caffeine is safe at high altitude because if you stop drinking, you will experience some kind of withdrawal, and that can cause symptoms like the AMS. And then also, you should not go higher. If you experience acute mountain sickness, you should go down. Do not climb higher. But before I proceed with the prophylactic, pharmacologic prophylaxis and treatment, I would like to share my experiences with acute mountain sickness. I have a couple. So there is a video and a picture here to my right. So the video was my first climb to Mount San Jacinto, my first climb with with altitude. And at 9,800 feet, I had a headache and I felt dizzy. But I don't like to go down because I'm already there. So every time I stand up, I feel dizzy and headache. And I just take a few steps and then stop. Take a few steps and then stop. Until for a couple of minutes, I was able to acclimatize and I was able to reach the summit. But it was really a struggle. You can see me like breathing hard. And then the other one, the picture was in Palcoyum Mountain, Rainbow Mountain in Peru last year, 6,000 feet. The moment I got out of the van, I had a terrible headache. Our guide, we're in a group, we're 14 in a group, so the guide sprayed us with, he called agua florita, so we snip those and it helps with the headache. And some members also of the group brought some coca leaves. So they were giving me coca leaves. I was chewing coca leaves like a cow. And the guide always checked on me. You want to go back? I said, no, I don't want to go back. Um, I was able to complete the 2.5-hour hike in Palcoy Rainbow Mountain, but the guide was babysitting me all the time. I was the only one who had the EMS in the whole group. The guide had a portable oxygen with him, but I was fine. I was able to complete and, you know, went back to Costco. Fine, only headache still. And now let's proceed to the pharmacologic prophylaxis and treatment. So number one is acetazolamide. Acetazolamide decreases the pH, the blood pH. Remember, when you are gasping for air, when you are at a higher altitude, you are hyperventilating, making your pH alkalotic, high pH. Acetazolamide will prevent the breakdown of carbonic acid and thus lowering down your pH, increasing your arterial oxygen and also increasing your respiration. So you will be breathing better. And you have to take this a day before the ascent, or up to 48 hours, or until the maximum height summit is reached. And I don't think you will get side effects for just taking this for a few days, but usually you have frequent urination because it's a diuretic. Frequent urination, numbness or tingling, blurry vision, and drowsiness. And this medication is a prophylaxis and also a treatment for AMS, HAPI, and HASI. And the next medication is dexamethasone. It is a steroid, so it decreases vasogenic edema. I mentioned it earlier, the cause of swelling is the disruption of the blood-brain barrier. So dexamethasone is a prophylaxis and treatment for cerebral edema. And you have to take this on the day of the ascent and in 3 to 5 days or until the maximum height is reached. And do not take this longer than 7 days. So again, what are the side effects? Increased blood sugar. Maybe your blood sugar will go up. It will really go up even if you use it for just a couple of days. But I don't think you will experience infection or osteoporosis, because these are the major side effects of steroids. And then we have aspirin or ibuprofen. This one will help alleviate the high altitude headache. And then also it can cause gastric or gastric upset, stomach upset. I don't think you'll get bleeding by just using aspirin and ibuprofen in a couple of days. And then the next one is nifedipine. So nifedipine, this is DHP, the hydropyridine calcium channel blocker. So it will help lowering the pulmonary arterial pressure and thus improving oxygenation and gas exchange. And you can take this at the start of the hike or 3 to 5 days or until the maximum height is reached. And this is a prophylaxis and also a treatment for your happy high altitude pulmonary edema. Uh, Side effects, hypotension, okay, peripheral edema. I don't think you'll get peripheral edema by using just for a couple of days. And then also dizziness. So the last medication, which is surprising to me, which also will surprise you, are the PD5 inhibitors. The sildenafil and the tadalafil, your Viagra and Cialis. And it is a prophylaxis and treatment for your high altitude pulmonary edema. What does the Viagra and the Cialis do? It will supply more nitric oxide, and nitric oxide relaxes the blood vessels of the lungs, allowing more oxygen. And you will take this on the day of the ascent, or 3 to 5 days, or until the maximum height is reached. Common side effects, headache, GI upset, and flushing. That is all for today, and hike